Okay, let's jump in and kick things off. Thank you all for joining us for this Resilient Healthcare Coalition webinar on the value of vaccines, building economic resilience, and the importance of immunization to the economy, to society, and ultimately to patient care and patient outcomes. We have a super impressive and diverse array of speakers who will be joining us today for this conversation. And it's with great thanks that I will be introducing each of them in turn right now. Introductory remarks for this session will be given by Vincent Caron, who's Vice President of Policy at the Ontario Chamber of Commerce. Vincent joined the OCC last September, where he previously held positions of increasing responsibility at Canadian manufacturers and exporters, most recently as the Vice President of Ontario Government Relations and Member Advocacy. Prior to his work at CME, Vincent worked in the governments of Ontario and Canada for 15 years, 6 federal ministers in various departments, including Industry Canada and Public Safety Canada. He also served in the Corporate Affairs Department of the LCBO, which is a fantastic job, but not one we will be talking about today, unfortunately. Then we'll be having anchor remarks and some very important foundational commentary and insights from Eddie Nason, who's the Director of Health at Signal 49. Eddie spearheads the efforts of Signal 49's health team, ensuring the delivery of high quality, relevant, and impactful research and products to clients and stakeholders across the health sector. Prior to joining Signal 49, Eddie spent more than 20 years collaborating with national and international think tanks and research and innovation organizations, including the Institute on Governance, the RAND Corporation, CIHR's Ontario SPORE Support Unit, and Genome Canada. Then we'll have 2 respondents to Eddie's insights and presentation, Jeff Beach and Dr. Jason Field. Jeff Beach is the President and CEO of Asthma Canada. Prior to joining Asthma Canada, Jeff was the Executive Director for the Canadian Spondyloarthritis Association, or CSA. His career began with Canadian National Institute for the Blind and evolved to progressive leadership positions across multiple patient-focused organizations, including the Arthritis Society, Victorian Order of Nurses Canada, and Cystic Fibrosis Canada. Jeff's also a member of the Resilient Healthcare Coalition Steering Committee. Dr. Jason Field is co-chair of the Resilient Healthcare Coalition Steering Committee, but also president and CEO of Life Sciences Ontario. Jason joined LSO in 2011 as executive director and has been president and CEO since 2014. He obtained his PhD in chemistry from the University of Massachusetts, his undergraduate degree from the University of Waterloo. In 2007, he joined the Ministry of Economic Development and Trade, where he was integral in the development of a number of strategic policy initiatives, spearheading negotiations that resulted in significant new investments in the province. And our final concluding remarks speaker today will be Ryan Locke, who's the Director of Federal Affairs and Public Policy for GSK Canada, another member of the RHC Steering Committee. So with that, let me just take a moment to introduce the Resilient Healthcare Coalition itself to those who are less familiar with the organization. The RHC has been an active and important kind of hoster and convener of conversations like this and shaper of policy across the country for more than 5 years now. Its core mission is to create more resilient healthcare systems in Canada that deliver better care earlier, more efficiently, and more effectively, ultimately supported by a world-class life sciences ecosystem. As you can see on the right, the RHC brings together 3 core communities that don't spend enough time engaging with each other on shared solutions to shared problems. Industry leadership, patient group leadership, and broader ecosystem R&D and commercialization leadership. Our goals are to accelerate the adoption of innovative health technologies, to leverage data to better support system resilience and ultimately patient care, and to strengthen Canada's life sciences ecosystem around which and through which all of those other goals can be achieved. For more information about RHC, please find us at resilienthealthcare.ca. That is also the website that will be hosting a recording of this webinar once it's been completed, and we hope you will find it there as well as engaging with us today. The last point I'll make is just a simple one about housekeeping. So for those who have engaged with RHC before on these webinars, you'll remember that we use the Q&A function at the bottom of your Zoom screen, a little comment icon with a question mark inside it. If you click on that, you can send questions to all of the panelists and discussants and participants in this conversation. We will take as many of those conversations as possible. We'll weave them together. We'll feed them back to the attending conversationalists, and we'll address as many of them as possible. So thank you in advance. Put your questions in early, put them in often, and we'll get to as many of them as we can. And Jason and Eddie, Jeff, Ryan, will all make sure that they are weaving their insights and perspectives into their comments and getting back to as many of you as we can. And so with that, It's my great pleasure now to turn the microphone to Vincent Caron, who's going to offer introductory remarks on behalf of the Ontario Chamber of Commerce. So, Vincent, to you.
Thank you, Ross, and thank you for the Resilient Healthcare Coalition for organizing this webinar. I also want to thank every one of you who are joining us today, industry leaders, clinicians, government officials, public health leaders. We rely on you to have a vibrant conversation. Today, we're here to really discuss why adult vaccination should be considered a strategic investment, why that matters now because we're at a pivotal moment for Canada. Our economy is grappling with stagnant productivity, which threatens our long-term prosperity. Canada now ranks last among major economies in long-term GDP growth per person. And here in Ontario, our own productivity has remained stubbornly flat in recent years and in the last few decades. This is happening as the uncertainty of tariff impacts confidence and investment. And so the outlooks for the next few years, unfortunately, are not bright. That's what we see in our Ontario Economic Report, and both the economic data and the perspective of Ontario businesses. They're investing less in expansion, they're delaying capital projects, they're slow to adopt new technology. And when we ask businesses, are you confident in the Ontario economy? Only 23% said yes. Among small businesses, it's just 20%. At the same time, our population is aging. Nearly 2 in 5 Canadian adults are now over 50, and people are working later in life. So these two things together, lagging productivity growth and an aging workforce, makes today's discussion really urgent. Put simply, Canada cannot afford to leave any productivity on the table. And yet, we often treat factors that influence productivity, like workforce health, as separate from our economic strategy. In particular, adult vaccination is too often an afterthought. And we moved on from the pandemic, and then too often we put that aside. We forget that investing in adult vaccination proactively is fundamentally about investing in our people's capacity to contribute, investing in the human capital. If older employees and working caregivers are better protected from preventable illnesses, they can remain on the job and they can keep sharing their skills. This is personal for me. We'll hear from Jeffrey Beach later, and I relate to his advocacy as my daughter and I are two of the 4.8 million Canadians who live with asthma. 4 years ago, I was in the hospital room with her, and you watch the oxygen levels dip. That's a place a father doesn't want to be. And more fundamentally, it impacts your life. When you have to deal with the impacts of preventable illnesses. Canadians with chronic illnesses like asthma are more susceptible to develop a range of conditions. That includes shingles, which we're going to talk about later. These conditions can sideline workers for days. It robs them of productive time and it forces family caregivers to take time off as well. When we prevent those illnesses, we protect not only the health of people, the health of our sons, daughters, friends, but also their capacity to contribute to economic growth and social well-being. And that is why adult vaccination should be seen as a strategic investment. Healthy aging, high-performing businesses, that goes hand in hand. And so as we kick off today's webinar, we need to really shift our thinking. We need to treat adult vaccination not as a mandate or an expense, but as a long-term investment in our people, our productivity, and our prosperity. The shift is essential if you want to overcome today's challenge and build a more resilient economy and a health system for the future. So I'm really excited for the discussion today. Over the next hour, we'll hear from experts from the business and health sectors, how we can turn insight into action. The Ontario Chamber of Commerce, we represent businesses of all sizes, all sectors, every community across Ontario, and I think this matters to everyone. We know how essential a strong life sciences sector is to our province's broader competitiveness. And that's why we're deeply grateful for the leadership of the coalition. So we want to work with all of you to build a healthier, more competitive Ontario. Thank you for your leadership. Thank you for the work you do every day to advance health, prevention, prosperity. So I look forward to a rich conversation.
Vincent, thank you so much for those perfect opening remarks and for the OCC and its role in driving forward so many of the goals that we share in common. Your notion or your articulation of the connection between a resilient economy and a resilient workforce is a very powerful one, and I appreciate you underscoring that connection at the very beginning of this conversation. So, with that, now to the meat of the issue and the insights and analysis that Signal 49 has prepared to help us better understand the opportunity and perhaps some of the factors impeding our ability to realize that opportunity. So to you, Eddie Nason.
Thanks very much, Ross, and thanks to the coalition again for putting this on and bringing this to the forefront of people's attention. I'm going to share some slides so that we can walk through this together. Okay, so what I want to do is talk people through this concept that Vincent has already set out, which is that healthy aging and economic resilience are one and the same thing in this case. And the way I want to do that is by talking through an example and working through what it means when you think about shingles vaccination as an adult vaccination approach to bringing these things together. Just before I jump into that, I do want to let people know who Signal 49 is. So Signal 49 Research is an independent applied research organization working across a number of lines of business, big strength in economics, working in health, but also working in things like innovation and technology and in human resources. So tied into a number of the areas that are involved in this work. And we really have an interest in improving the decisions that Canadian decision makers have to make. We want to provide the evidence and the insights that allow people to make better decisions using a variety of different tools. And from our perspective and from my perspective as the lead of health, this is an interesting area because it ties together those concepts of health, of economy, of human resources, and provides some of those insights that we think we can provide some value to. So that's really where we are interested, and this is why this is something that Signal 49 really wanted to be engaged and involved with. As Vincent mentioned, productivity is an issue in Canada. There's a big platform here that needs some sort of solutions. We know we need stronger productivity. It's a way to protect our economy from increasingly high inflation. We know that's been a challenge across global economies. And as Vincent mentioned, we have seen significant stagnation and, in fact, loss of productivity compared to other OECD countries. For example, we have dropped to the second lowest in terms of our drop in productivity in the OECD over the last 25 years. And that's a real challenge, and one which our current government, including our Prime Minister, is very clear is something that we need to do, make change on. So we cannot we are not able to deliver on the things that we want to deliver on as a country unless we are able to improve our productivity. We are not going to be able to provide the resources and the supports that makes Canada Canada. And so it's a really important component to make sure that we build people into our ability to defend productivity. And as Vincent identified, that people demographic is shifting. We are aging as a population, and obviously those who work in the healthcare sector will know that this is a constant conversation around how the healthcare sector runs, but it's a constant conversation around how labor force runs as well. And we want to make sure that we create a connection between healthy aging and productivity. We want to make sure that as we increase health span, the ability for people to stay healthy through their lifespan, we are driving that into how people are able to either provide care to their loved ones, to volunteer, or to stay in the labour force. So we know that the labour force is increasing as an over 50s. So we really do want to make sure that we are providing people with those opportunities to really be integral parts of how we deal with our productivity challenges. So it's not the only way to work on productivity, but it's a very key component, and it ties into other challenges. So within that, if we want to make sure we keep people healthy, one great way to do that is to prevent them from getting sick in the first place. And so as you get older, the chances are you are going to become more liable, susceptible to longer term health problems. And one way we can try and manage that is to say that we can build vaccination programs that build preventative health. So we can look at how preventative health as a component is really part of delivering value for patients, value for healthcare and the system, for the professionals, healthcare professionals who are working in it, and societal value. So what's called the quadruple aim for those working in healthcare and healthcare systems. But the challenge we have is that there is often a difference between what is a good idea, what should we do, what's the recommendation, and what are we able to deliver, and what are we willing to deliver, and what evidence do we have to make the case for that. And so we see this difference between what is a recommendation for vaccination and what is coverage. And this is a regular thing. We talked about this a lot in COVID around the idea that what we would like to see is the entire country getting vaccinated, and we want that as our goal, but we actually need to work our way to get to that because that is not how coverage systems work. The recommendation is not the same thing. And so we need to find a way to move it forwards. And from our work at Signal 49, what we were interested in is saying, okay, well, we really need to focus in here on something that's going to help us get to an understanding of these issues. How do we close that gap? How do we understand the benefits? How do we provide that value? And so rather than trying to boil the ocean and talk about all of adult vaccinations in one go, we thought it was a wise move to talk about one vaccination for adults that is very, very prevalent, but a existing effective vaccine that we know works well and is recommended across the country, where uptake has been lower than we would hope. And so we decided to look at shingles. As you can see from this slide, shingles is very common. So 1 in 3 Canadians will get shingles over their lifetime. And this is at the level of a conversation that we have about people getting cancer across Canada. This is a lot of your population. So even if you are looking at this as a small issue, okay, well, shingles not big, it's not going to kill off lots of people. What we're still saying is that this is an important component because lots of people are being burdened with this, and that burden is having an impact on them, on their communities, on their work. And so it's worth thinking about. So we know that the risk of shingles increases as you get older. We know, as Vincent mentioned, that if you have chronic conditions, your risk is also increasing. We know that it's a vaccine preventable condition, so we've got a good example, working example. And we know that government national recommendations are for people over 50, that we should be trying to make sure that at a national level, people over 50 are being able to be vaccinated against shingles. But that vaccination happens across the country in uneven ways. Provinces and territories have their own programs. Their own programs are determined by what they think is important, not just the recommendation. And so we see that kind of patchwork of approaches. And what this has led to is that only around 40% of those eligible Canadians are actually vaccinated. So that's a big gap of people that we could be getting to that currently are not getting access and not getting vaccinated. And we know that there are impacts from that at the individual level. We know that this is causing people significant pain. We know it's causing quality of life issues. We know that it affects their chronic conditions. And as you age, it affects the chronic conditions that are more likely to be affecting you. We know that it affects the healthcare system. We know that it's going to increase demand across the system, whether that's in primary care or emergency rooms or in the ability to provide resources for people in terms of their treatment. And we know that there is that effect on productivity, and whether that's through people not being able to go to work, absenteeism, or people being less productive while they're at work, presenteeism, those are big issues. And those are things that we need to take into account when we're thinking about why this is an important issue to move forwards, with shingles as the example. So let's think about what it means to actually measure the value of shingles vaccination. We don't want to just understand that it's a good idea. We want to be able to have some kind of denominator that lets us say, yes, if you're making an investment, there is a benefit or a cost to that investment. So we need to create an economic modeling approach that allows you to look at the measurement of those costs and a measurement of the benefits that accrue from them, vaccination. And so in our work, we looked at what are those costs in terms of the ability of the healthcare system to provide the vaccination across to people, and what are the benefits in terms of the individuals who are getting vaccinated and the things that they are able to do if they are no longer dealing with the issue of having become a shingles sufferer. So building this model, we were able to look at, okay, what would those benefits look like if we were able to vaccinate 80% of Canadians? What would the value accrue over their lifetime? And that means if we're looking at people over the age of 50, what does it mean in terms of their ability to stay in work and to be more productive at work? What does it mean in terms of their caregiving and their volunteering? We know these are important components of functioning societies, and they have knock-on effects to productivity as well. And then in addition to that, we want to understand, because there are benefits and costs associated with actually delivering the vaccine and providing support for people with shingles, we want to understand the demand on the healthcare system. Is there a shift in terms of the costs associated with emergency department visits or primary care and medications? We need to understand those costs and those benefits. And we also want to understand what are the impacts on people's quality of life. That is a huge issue. It's often how we decide to really monetize the benefits of health interventions in Canada, in the UK, across Europe, in the US, really making sure that we understand what those benefits look like in terms of a monetized version. So I won't go into the details of the model, but essentially, if you put all those things into the model, and feel free to go and read the paper, it's on the Signal 49 website. It's a great read. It's a very interesting thing. It allows you to walk through how the model works. But what we see is that with our assumption that we're looking at 80% of adults across Canada getting vaccinated who are 50 years old or older, there is an initial investment to make sure that vaccination happens. And that investment is around $3.8 billion. But if you're going to make that investment, what do you get from it? Well, the first thing you see is that there are immediate savings in healthcare costs. So we know that we are no longer having to provide a number of primary care and emergency department visits and medications, and that provides you over $800 million in healthcare cost savings. You then want to look at, okay, well, what also is that benefit in terms of the health benefit to individuals? What is their quality of life? And using the way that we monetize essentially a year's worth of quality of life, what you can say is looking at how people, because of the large number of people that are affected by shingles, a large number of people affected by shingles, you're looking at a $4.2 billion health benefit by being able to provide this level of vaccination. And then we want to also understand, okay, well, now that these people are healthier, we've managed to cut down their costs in the system. What are we seeing in terms of that benefit spilling over to the economy? What are those benefits in economic productivity? People are able to be at work or to provide caregiving or to volunteer. And we saw that what you see is around a $1.5 billion gain in economic productivity. All of that adds up. You can see that what we have is a return on investment of 1.69. Essentially, every dollar that you invest in shingles vaccination, with 80% of your adults over 50 covered, leads you to $1.69 in return. So we've got to the place now where we are seeing that there is a greater benefit than there is cost. Sign of a good investment. And in this case, a comparable investment return to something like workplace mental health programs, something that many, many workplaces have seen fit to spend money on and see as a benefit and a boon to their employees and their workforce. So definitely something that we know is comparable in value to things that are already implemented across the country and across the system. And so I mentioned the idea that what we see is challenges across the country because there is that difference in how things are implemented. This is what the country looks like if you actually take away those differences in implementation and you try and provide that benefit for those 80% of age 50 plus. And you see that actually what we get is we get very consistent returns between 1.63 or 1.57 in Atlantic Canada to over 2 return on investment in the territories, essentially saying that what you get is improved productivity from your workforce, your over 50 caregivers, your volunteers in all of these situations. It is not being driven by one part of the country. It is not being tempered by different types of population. We are seeing significant benefits across Canada. And so this is a wise move, not just for Canada as a whole, but in different parts of Canada where different systems are trying to put this in place. Challenge we have right now is that there are only 6 of the 13 jurisdictions that have public coverage for older adults. Um, and that public coverage varies pretty widely from the age range that you're in, whether it's 50 or 65 plus, whether it's the ability to provide supports to people who are immunocompromised. None of the provinces or territories across Canada provide supports directly to people who have chronic conditions because of the alignment of chronic conditions with shingles and the implementation of that, the implications of that. So this is how we've got to that unequal access issue, and we can show you now that there is benefit. There's an economic reason to do this. So the last thing I want to say is that I can show you the economics and lay out the numbers and tell you that it's a great idea. The problem is we've got to find out how to get to that great idea. 80% of coverage for 50 plus doesn't just magically happen. It's not just a case of throwing money at it. It's not just a case of making sure we can afford it. It's actually all of the parts of the system that need to work together that we do this kind of shift efficiently. And so in order to realize that return on investment, we really wanted to think about in our report, where are those points? Who are those groups? Who are those people, those interest holders that have to be engaged and involved to make this happen? And so we looked at what does it mean to support decision makers to be able to do this effectively? Well, part of it is being able to say, yes, you get a positive return on your investment. So you start to build some of those decision-making criteria. Here's why it's a valuable thing to do. But also you need to build decision makers with the right data systems. We need to make sure you've got the right delivery models for that vaccine to get out to the population. You've got to be able to have the setup to implement vaccination across the country. We also know then you've got to be able to empower healthcare professionals. And that means that those people who are on the front line, making sure everybody gets vaccinated, they are varying from family doctors to people providing this through workplace health, through to pharmacists. We need to have some consistency in scope of practice and in the capacity of those groups to be able to get out and provide vaccinations and be able to talk to people about the value of that. So really making sure that they have the tools at their disposal to not only make sure that they are able to give it to people, but also that they can ensure that people know it's valuable for them. And then we also wanted to say that we're talking about this as a productivity issue. So there is a reason for employers to be interest holders here. And we need to be able to provide the tools for those employers to understand that there is value in shingles vaccination as a part of how they move forward in supporting their employees. In the same way I talked about the idea that workplace mental health is an issue and you get that return, this is an opportunity for employers to see the return they get through supporting their workforce through shingles vaccination, whether that be putting that as part of the case of the benefits program that your employees have, encouraging people to pursue shingles vaccination as they reach the 50 plus age range. All of these opportunities, sharing knowledge, sharing values, really helps to ensure that we can push that 80% coverage level up to really get to that actual return on investment and see that 1.69. So the investment that we make is the wisest one and helps us get to the place of really improving productivity, seeing benefits for people, for society, for communities, and for employers, and then for our economics as a whole. And so that's really where this work sits and why I think it sets a question up to say that we've gone from showing you the example with shingles to looking at how do you then build this out. There's been work done on what it looks like for the ROI from a variety of adult vaccinations. Here we've got an idea of how it works for one individual vaccination, and now you've got the ability to build those systems forward and really provide that value to Canadians and older individuals across the country. So thank you for providing me with some time to talk about this. I am looking forward to discussion and engaging with everybody on how we move forward with this.
Eddie, thank you so much for kicking off this conversation. You have left me with many questions, and I know others as well as we see some start to come in through the Q&A function. I'll just flag that not only will we make sure that your report obviously is already available on the Signal 49 website, but we'll link it alongside the video recording of this webinar on the resilienthealthcare.ca site as well. So we'll get this report into as many people's hands and eyeballs through as many sources and channels as possible. So with that, we've got a couple of really thoughtful and complementary responders who are going to sort of pick up on some of the pieces that you just laid down, Eddie, and bring their own insights and perspectives to this. So I'm going to start with you, Jeff, to offer the perspective from your own kind of patient orientation, your key lenses, and the Asthma Canada view. So take it away.
Thank you, Ross. And I also want to start by thanking Vincent for sharing his own experience with asthma and his family. The impact on the patient is really what I want to focus my comments on, and how that relates to these economic factors that we're talking about as well. The truth is, for people living with asthma and other lung health diseases, vaccine preventable diseases are not just short-term illnesses, not just minor annoyances or interruptions in someone's day. They can actually destabilize what is already a fragile baseline for these patients. The infections that we're talking about really trigger exacerbations, increase medication use, and can lead to emergency visits and hospitalization. So when we talk about vaccination, we're really talking about preventing a cascade of deterioration, not just a single episode of illness, which is a really important point to keep in mind. We know that vaccines are among the most cost-effective public health interventions, preventing millions of illnesses and deaths globally every year. If you take just respiratory illness, the burden of these illnesses remains substantial in our healthcare system in Canada. Diseases like influenza, pneumonia, pneumococcal are major cost drivers, hospitalizations exceeding hundreds of millions of dollars annually, and are actually rising in recent seasons. Interestingly, CIHI reports that hospitalizations for vaccine-preventable respiratory diseases reached 142 per 100,000 Canadians in 2024-25, which is actually more than double pre-pandemic values. From an economic perspective, every hospitalization avoided through vaccination means lower direct healthcare costs, reduced strain on already strained hospital capacity, and less productivity loss and better quality of life. So for people living with asthma, COPD, and other chronic lung diseases, they're at significantly higher risk of severe outcomes than others who do not live with these diseases, making vaccination in these populations essential, not optional. Yet, vaccine uptake remains lower than national targets. Some of our recent surveys have shown that only 4 in 10 adults with chronic conditions report receiving influenza vaccination, for example. We know that these gaps, and the ones that Eddie covered as well, translate directly to avoidable exacerbations, hospitalizations, and ultimately system costs. So looking at asthma, for example, respiratory viruses and bacterial infections, including influenza, COVID-19, RSV, and pneumococcal disease, all contribute significantly to hospitalizations and system pressures. They can worsen asthma control, prolong recovery, and increase the risk of long-term complications. From a life course perspective, it's also important to consider vaccines for diseases like shingles. As was mentioned in Eddie's presentation, 1 in 3 Canadians will develop shingles in their lifetime. And because asthma is a disease that affects the immune system, it doesn't just increase risk from respiratory disease, it also raises the risk of shingles, making vaccination an important part of overall disease management. And that's part of what groups like Asthma Canada and the Lung Vaccination Working Group, which is a group of national coalition of respiratory-related health groups like mine, that are really working hard to increase uptake, education, and awareness for the importance of vaccination as part of overall disease management. It's part of good disease management. People with asthma face a higher risk. Studies have shown up to about 24% greater risk of developing shingles than people who do not live with asthma. And it also can lead for people with asthma with greater and more severe complications of shingles. From a patient perspective, the value of vaccines extends well beyond the system's savings. Vaccines prevent exacerbations, they reduce hospital visits, they preserve independence as people age, and they improve quality of life. For people with asthma, each prevented infection means fewer days missed from work and school, fewer urgent care visits, and lower risk of long-term complications, which can be the effect of some vaccine preventable diseases, as I mentioned, for people whose systems are already compromised. So increasing the uptake of vaccines across influenza, pneumococcal disease, COVID-19, RSV, and shingles would be one of the most important, impactful, evidence-based investments that we can make. For the respiratory community, it is a critical part of disease management and prevention, and really, it's good medicine and good economics at the same time. Thank you.
Jeff, thank you. Tons of pieces that you just wove together, and I know many of them we're going to come back to in the Q&A section. So I really appreciate your lovely build on Eddie's foundational commentary. So Jason Field, to you, offering your perspective from the senior role at Life Sciences Ontario and all of its members who have such a key role to play in the conversation we're having.
Well, thank you, Ross, and a special thank you to RHC for convening the conversation today. I think the key takeaway here, from my perspective, is that we can't view vaccines just as a narrow health system cost. Yes, they are a health intervention, but they're also a tool for supporting economic resilience. They help people stay well, remain active in the workforce, and continue caregiving, volunteer in their communities, and participate fully in society. So that aspect of vaccination just can't be overlooked, and especially at this moment of time right now in Canada, because we are facing persistent productivity challenges, as was mentioned earlier, an aging population, and a much more uncertain global environment. We've seen our traditional trade relationships are shifting, supply chains are being tested, and countries around the world are competing much more deliberately for investment, talent, innovation, and economic security. So in that context, prevention is not just a health policy issue. It has to be part of a larger strategy for Canada to be globally competitive in this new world order that we're facing. So when preventable illnesses take people out of work, they disrupt caregiving, increase demand on primary care or hospitals, or reduce independence later in life, these costs show up far beyond the health budget. They show up in employers' operations, in household stability, in public finances, and in Canada's overall productivity. So I think the Signal 49 report is incredibly timely, and the shingle example is a really powerful one because it demonstrates that adult vaccination can generate measurable value. And importantly, the analysis, I thought, was framed in a very credible and transparent way, which is exactly what policymakers, employers, and system leaders need if prevention is going to be taken seriously as an investment. So from my perspective here at LSO, there's a few points that I'd like to make. The first is, Canada has extraordinary scientific talent, clinical and industrial capacity in vaccines, and life sciences more broadly. We have companies, researchers, clinicians, and policy leaders who really understand how to translate science into public benefit. To really fully realize that benefit, we need systems that value prevention appropriately and make it easier for people to act on these evidence-based decisions. And so what we're talking about here is an actual culture shift from a system that was built from the very beginning on acute care to one that moves upstream to prevention. It's not an easy thing to do. Second, uptake really matters. A vaccine that sits in a guideline, a fridge, or a pharmacy, but doesn't actually reach the person who can benefit from it, that's unrealized value. That's why data infrastructure, in my mind, is so important. Um, a modern vaccine registry could help identify gaps in coverage, support clinicians and pharmacists in recommending the right vaccine at the right time, and generate real world evidence to measure impact. It would also move us beyond all those little yellow cards that all of us have tucked in drawers somewhere in our house, and towards a system where patients, healthcare providers, and policymakers can work from a common data repository. Can also be a strategic advantage from a health security perspective. So, a really great example of that is during the COVID-19 pandemic, Israel was able to access the Pfizer vaccine quickly, in large part because it had strong digital health infrastructure and could generate population level evidence on vaccine rollout and outcomes. And that capability helped support early access, rapid uptake, and real world evaluation in real time. The lesson here for Canada isn't just to copy another nation's system wholesale. It's to learn that data readiness itself can become a strategic advantage when a new health technology emerges and when speed, trust, and evidence really matter. So, in the times of crisis. So, this should be part of our pandemic preparation approach as well. Third, we need to recognize that primary care electronic records are necessary, but by themselves are not enough. So we know here in Ontario, we're advancing a province-wide primary care medical record, and that is a really important step, one that we here at LSO fully support and endorse. Vaccination does not happen only in a family doctor's office, nor should it. For example, we've seen the expanded scope of practice for pharmacists, which is really critical in making immunization more accessible around the province. That is one of the strengths of our system that we're building and expanding upon. But it also means that the data infrastructure has to follow the patient across these different settings. Otherwise, we're just going to end up where we are now with a fragmented data system that doesn't allow us to make informed, evidence based decisions. Finally, we need to broaden the way we assess value. If we only count the immediate program costs and ignore the downstream benefits, fewer complications, less caregiver disruptions, better labor force participation, reduced pressure on healthcare providers, we will consistently underinvest in prevention. And that's not a sustainable approach for an aging society like what we have in Canada. So to me, the opportunity is to reframe the value of vaccines as part of Canada's productivity, competitiveness, healthy aging agenda. It's not about choosing between health and the economy because we know health and wealth has to go hand in hand. It really is about recognizing that a healthy population is one of the key foundations of a productive and prosperous economy. So I know that at RHC, at LSO, and the life sciences sector broadly, we all stand ready to work with government, employers, patient organizations, and health system leaders to help build that more integrated approach. If we want a healthier, more productive, and more resilient Canada, prevention has to move from the margins of policy the center of our competitiveness strategy. And I think vaccines are a natural starting point for that transition to take place. Thank you very much. You're on mute, Ross.
Yeah, thank you. Fantastic build and important points well made as usual. So maybe we'll start with sort of where you left off, which is that, Eddie and Vincent and yourself and Jeff, you all articulated a very powerful case for a variety of measures designed to increase immunization across Canada. And yet, whether you look at shingles or other vaccine preventable illnesses, there still is a massive gap between where the numbers, that magical 80% that Eddie built the whole report around, and where we actually see those numbers across the country. So if each of you could pull kind of one policy lever that you think would make the biggest impact in closing that gap, and I know there's lots of levers to be pulled, and I know you'd like to pull all of them, but Eddie, maybe I'll come back to you. Where do you think one of the areas of biggest potential impact could be in terms of changing the sort of future immunization state versus the current immunization state?
Yeah, I'm hoping that we can all pull a different one each, and we can at least get four of them pulled.
Yeah.
Yeah, I mean, I think that there is a large issue on shingles specifically around people not thinking that is necessary. And
Hmm.
so building that capacity both of the populace itself, but also of those working in the healthcare system to really make it clear where this is valuable and why this is valuable. So giving people the decision support tools, giving people the capacity to know that this is something that they should be doing and actually is going to benefit them. I've spoken to so many people who have had shingles and have gone, oh my God, if I had known it was like
Yeah.
this, I would have got vaccinated as soon as it was possible. Um, and so I think the ability to give people that knowledge and understanding of why there's value in it lets you get to that higher level. And we saw that with COVID, right? We know that if you can create the platform for this is important, you should be able to do this, then we'll be able to make that happen. So I think from my perspective, there's an educational kind of capacity, system capacity approach.
Thanks, Eddie. Jeff, do you want
Yes.
to pick up on that? Oh, sorry, Jason, go ahead.
Well, I just wanted to build on Eddie's comment
Please.
there. I'm going to cheat and get two in. So I want to build on his comment. One of the reasons I think people don't necessarily think that it's required is in certain provinces it's not reimbursed right away, right? So if the government doesn't feel that it's important
Uh,
enough to reimburse it, even with the NACI recommendation, people in the general population will say, well, the province doesn't think it's that important, so
yeah.
why should I? So I think, tied to that has to be the harmonization or the reimbursement across the country so that the access is consistent.
Thanks, Jay. Jeff.
Yeah, that is absolutely certain as well. And I think for me, I would just take it one step further and say we need to look beyond just age
Yeah.
parameters when it comes to access and consider the impact that chronic diseases like asthma have on the immune system. And the fact that people who live with a disease like asthma are more vulnerable, therefore, the access should not be entirely limited by age, but also having some kind of an acceptable definition of a chronic condition would go a long way in terms of helping to ensure access because cost is a factor for some people. And oftentimes that makes a difference between somebody moving forward with a vaccine or not. I mean, there are lots of other factors involved, but I think having public access across the board for people with health conditions that affect the immune system would be a huge step forward.
Mm. Jeff, thanks for that. Ryan or Vincent, do you guys want to join this conversation now that we've broadened it to the dynamism of lever pulling and the changes we need to see made?
Well, thanks, Ross. I might just take my hat off for a moment to the government of Ontario for a decision that was made and announced not all that long ago to make shingles and a number of other publicly funded vaccination programs now available in pharmacy. A couple of you have touched on earlier the importance of not just having vaccines available through family doctors, but multiple points of access. With, I think my math is right, 1 in 10 Ontarians still not having a family doctor. Being able to now access those in pharmacies is a game changer, and it lives up to that scope of practice that we all know pharmacists have and can leverage.
Vincent?
I
Thanks,
think
Ryan.
that actually, just jump in here quickly,
Of course, Jeff.
Ryan's point, I think really supports what Jason was talking about earlier in terms of the need for electronic medical records and vaccine registries.
Yeah.
Because if people are able to access vaccines in multiple points of care, that's great. But we need to keep track of these and ensure that we do have the strong data as well. And even just from a patient management perspective, knowing what you've been vaccinated for, what you haven't, especially as you get older, is something that we have to
Yeah.
consider as well. So I think that kind of ties it all together.
And Jeff,
Jay?
just to build on
Yeah.
that was going to be my second point that I was going to cheat and add in there. If there was like one policy initiative that I think could really move the needle, I think that vaccine registry piece is the one, because like we need to be able to measure, right? And having that strong data allows us then to figure out, in terms of the demographics, in terms of geography, where we're having impact, where we're falling down, where there's gaps. And so it's really informed evidence-based policymaking that is being enabled by that data infrastructure. So I think a vaccine registry, if there was one thing that we could do to improve access overall, to me, that's the key.
And I'm going to make it one and a half things by saying add vaccine scheduling, adult vaccine schedules to the vaccine registry so that people know when they're meant to be getting things.
Yeah, I think that's a really
Vincent?
key point. That's a really key point. I really want to build on that point. I mean, we last week we did a roundtable with professionals from public health, from life science sector, from the nursing association, the hospitals. I think across the board, I think that interoperability of the data, right? Like the ability to access it amongst across different domains is a really big thing. You see parents, I think, struggling with the record management. I mean, we're still functioning with that yellow booklet, which is a bit of an anachronism, where there's promising efforts like immunization.ca where you can start gathering some of this data together, but it all still rely a lot on the behavior of individuals sitting down with their records and going in, putting in and going on the regional public health website. There's really a patchwork of public health data record keeping here. So having something that's central, that's accessible, that where you can track the progress. I mean, I know as a parent, I would welcome it, but I think it just to the broader point that we're making, it's actually more than about convenience. It's about hours saved and people caught, and where we can say, okay, so we don't have to send thousands of letters to people who are mostly compliant to be able to confirm that everyone's like children are properly vaccinated, and then carrying that record keeping, that efficiency later on through life, where you may be on the job today, not really thinking about your later years, and then all of a sudden you get a notification that reminding you about the shingles vaccine, right? And if you ask everyone question proactively, do you want to get shingles? I think the answer would be a resounding no, but it's an afterthought, right? And we don't think about it.
Vincent, it's a great build, and I mean, there was a very poignant comment again, sort of coming back to the presenteeism, absenteeism piece that Eddie talked about. Somebody in the chat, sort of very poignantly said it took, I missed 8 days of work because I was caring for a parent who had shingles, and how do we make sure that those pieces are captured so that we are accurately conveying the problem, not just for patients, but also for their caregivers and their communities. And then how do we actually quantify the benefit of that solution, building on the work that Eddie has done already? So, Eddie, maybe I'll give you almost the last word on this to create a little space for Ryan to wrap things up. But as you reflect on sort of these two pieces we've talked about, one is making this problem as crisp, as clear, and as compelling as possible. The policymakers move upstream, which you've all said is incredibly important. That problem piece, what do we need to do to profile that problem more compellingly? And then what do we need to do to make sure that the right solutions are getting delivered in the right way as a group like this? I know those are both giant questions, but maybe just if you think about kind of what the next arc of your work would be, if there's going to be another version of what you've already sort of delivered and shared with us today, where's the biggest opportunity for where we go next?
Yeah, it's a great question, Ross. I think a couple of things that leap out are one is the ability to build those data systems that give you the data to show you that you're moving forwards. Um, and I think the other one is the making this a compelling conversation that is beyond just shingles or the adult vaccination, like the adult condition that you're vaccinating for. As Jeff has saliently pointed out many times, this isn't just about the condition that you get. It's also about all the other things that are affected by it.
Yeah.
And that means what we've done is quite a small version of what actually is the real world system change here, is because we've looked at what it means for shingles, not what it means in terms of those knock-on effects in other areas, and also the knock-on effects of what vaccination provides for you if you're in those situations. And so I think being able to broaden the conversation to say that vaccination is great for the thing you're vaccinating for, it's also great for lots of other things. And that's where it makes an even more compelling case as we do this kind of joined up government approach, efficient healthcare, efficient productivity approaches. That's where you start to build an idea that, okay, well, this is bigger than the thing we thought it was. I think that's the thing that builds that compelling platform.
Well, Eddie, I think it's a perfect pivot, and maybe just the one quick piece that I'll just interject, and Ryan may touch on this as well, is all too often in Canada, we think if something is healthcare related, it is sort of solely, exclusively, and primarily the public sector's responsibility. And I think what's really interesting about this conversation, when we think about this question of productivity and presenteeism and absenteeism, it really shows that if you're moving upstream, you're also moving kind of younger. You are targeting people who are actively engaged in the workforce disproportionately. You are trying to move to that kind of younger stage in space. And that means you have to have a whole other array of actors, employees, employers, unions, and others who are having a similar kind of conversation to ensure that this isn't just, quote unquote, being left to public sector healthcare practitioners and delivery vehicles at ages of 60 or 65 plus or 70 plus, as Jeff talked about in terms. So we need to be much more inclusive about who's involved in the solutions, much more inclusive about who is being prioritized for treatment. And there's a lot that we can do together beyond what we're already doing today. So Ryan, why don't you wrap this up and get us to the top of the hour?
I think that was very well said, Ross. It will require, I think, an all hands on deck approach. And as we face this productivity crisis, as Vincent and others spoke about, nothing short of an all hands on deck approach is going to get us there. It's a hidden threat, this productivity erosion that's been happening in recent decades, but it's fundamentally why everything from groceries to housing, et cetera, is becoming out of reach for too many Canadians. It is the defining national challenge of our time. At GSK, we have deep roots in Canada, dating back to 1903. And it's because of those Canadian roots that we wanted to look at, can we be part of a solution to the defining national challenge of our time, which is the productivity crisis. And we had an intuition, some of us had an intuition that vaccines, and in particular those for older adults, could play an important role here in addressing that productivity gap. But a hunch or an intuition is not actionable evidence for policymakers who need to make choices on where and how to invest and prioritize. So it was that led us to partner with Signal 49 and Eddie's team, the 80 plus really smart economists that Eddie spoke about. And as Eddie said, 30% or more of Canada's labor force is now over 50, and that segment is growing rapidly. And then with a vaccine preventable disease like shingles that affects 1 in 3 Canadians over 50, we did want to see if broader access could drive a meaningful impact on productivity and achieve a return on investment. And it turns out the hunch we had was right. As Eddie spoke about, a dollar invested in shingles prevention returns $1.69 to the economy. I think that's a very clear and compelling takeaway. And that's not to mention as well the health benefits that accrue to individual patients and caregivers, avoiding preventable pain and suffering, or even the potentially even more serious destabilizing effects for patients with asthma or underlying health conditions that Jeff spoke about earlier. So that all hands on deck approach, as we move forward, it will require partnerships. And so I very much appreciate the opportunity to partner with RHC and its members to bring awareness on this issue. And we remain open to partnering at GSK. So please don't hesitate, any of you who are listening or watching this recording later, to reach out to myself or anyone at GSK if you'd like to learn more. So thanks for your attention and your time, all of you. Your time is valuable. Appreciate you spending an hour with us over lunch today.
Ryan, thank you. Wonderful closing remarks, Vincent. Thank you for teeing us up and connecting some of the dots to the world of OCC and its prioritization of, a robust and vibrant economy across Ontario. Eddie, thank you for the foundational research you shared with us and your thoughts on where we go from here. And Jason and Jeff, as always, your complementary insights and perspectives enrich any conversation you're a part of. So on behalf of all of us, thank you for joining us today. We're excited for the next conversation around an RHC table. But in the meantime, please check Signal 49 for the report that Eddie referenced, the foundational findings, and we'll see you again on the RHC website and around this table over the coming weeks and months. Take care. Have a wonderful day.